Hennig back here on 97.3 ESPN. It's time for the Ivy Rehab Injury Report. Ivy Rehab with over 18 locations around South Jersey offering best-in-class outpatient therapy. And you know why I can say they have best-in-class outpatient therapies? Because they're my physical therapy center, and they should be yours as well. I am actually going to be discharged soon in the next couple sessions, so they'll get a break from me finally after months of working on my neck. But joining us today, a new doctor joining us this week is Dr. Josh Makin here on 97.3 ESPN. Dr. Josh, how you doing today?
I'm good, Josh. How are you?
I'm doing good. Too many Joshes in the building. We
I
already
know. That's what I was thinking.
Well, you got Dr. Josh Lamb. It's like, apparently all the Joshes apparently work for Ivy Rehab, I guess,
Yeah.
or associated with Ivy Rehab.
Yeah, Josh and I worked in the same clinic, so it got confusing for a while.
Did you guys just go to last names at that point?
I think we went to like Josh 1 and Josh 2. And since he was the OG, I became Josh 2.
So you went Spider-Man meme on everybody. So
yeah.
Well, let's get to these injuries because they are some very interesting injuries. Again, Dr. Josh Makin joining us here on 97.3 ESPN. So let's talk about first Orion Kerkering. We mentioned him before you came on. So for those who don't know, he began the season on the injured list with a grade 1 hamstring strain. He was originally suffered the injury in February. Took about a month off, came back, and they thought it was a Charlie horse, later diagnosed with a strain. So can you first explain to the audience the difference between just getting a Charlie horse and what a strain really means in terms of the process of diagnosis and recovery?
So, I'm not surprised that they may have chalked it up as a Charlie horse at first. A cramp can be, kind of a quick strain or a quick stretch of a muscle that becomes, a little bit sore, but kind of goes away over a day or two, where a strain is going to linger a little more. And in Orion's case, a grade 1 strain of the hamstring generally, should be recovered within 2 to 4 weeks, right? It's usually going to be indicated on an MRI these are professional athletes, so they're getting the imaging, whenever they need it. And so on an MRI, you're going to see maybe some minor, if present at all, any tearing of the muscle tissue. And you're going to see maybe a little bit of weakness and soreness and potentially a little bit of swelling around the area. And in his case, it kind of depends on, is it in the meat of the muscle, like the mid-thigh of the hamstring, in the muscle belly, or is it a strain at the attachment sites, like at the your sit bones and your buttock, or at the back of your knee where the muscle becomes a tendon and attaches to those 2 points? If it's in the muscle, generally, like I said, 2 weeks, 3 weeks, 4 weeks, he should be recovered pretty good from that. If it's in a tendon, sometimes they can be a little bit more nagging for athletes, where that tendon just takes a little longer to heal because there's less blood flow there. And so they do take longer to heal in those areas.
So then what is the recovery difference between different parts? Because the hamstring I believe, is one of the biggest muscles in the body, right? So what would then be like someone comes into Ivy Rehab with a strain of their hamstring, but they say to you, I don't really understand how this works, right? So for someone coming into Ivy Rehab or for Orion Kerkering, what is the difference then in the recovery timetable for the different areas of the hamstring?
So it depends on the severity again. That's going to be graded on imaging. A grade 1, minor, if at all, any tearing of the tissue. Grade 2 is going to be definitely some partial tearing or some bruising indicated of some tissue damage there. And a grade 3 is going to be like an obvious tear or a rupture, and that's going to usually require surgery, right? So the first thing is to determine, what severity of a strain are we dealing with here? And then, initially when someone comes in, we're going to explain to them based on what we see on their exam. We're going to explain to them, all right, so we have some bruising or we just have some tenderness. So if it's just tender, a little bit of soreness, we're going to work on pain control first, right? Some soft tissue work where we're working on increasing blood flow to help improve the healing of that tissue. Maybe some ice if they need it, and some gentle stretching after like a week or two, because you don't want to stretch a muscle that's been strained. That's kind of a misconception a lot of times. People think, oh, you just need to stretch more. But if you already have a muscle that's been strained, stretching it right away to help lengthen it isn't going to help. We want to shut it down for a little bit and then gradually increase, our load on the tissue. And load's going to come in the form of a stretch or in the form of, athletic activity and loading the muscle up with running and sprinting and any other dynamic activity. So it really depends on the severity of the strain that the patient's dealing with, and then determining, when's a good time for them to start increasing their output, right? And that's usually going to be, when they have no pain, they can start jogging and, getting into some higher level athletic movement, sprinting and running. And you see in baseball players all the time, they hit the ball, they sprint down first place, and then they pull up with a hamstring strain pretty frequently. And that's why they're really nagging injuries for athletes is, we do a lot of stop, cut, go activities when we're playing basketball, baseball, football. And that quick, dynamic, explosive movement really puts a lot of strain through that muscle, and that's what usually causes it. So easing people back into their normal activities is key. And possibly they shut Orion down because maybe he had some pain, or maybe they just wanted to give him rest before getting into the meat of the season here, as it gets started up. So I'm not sure exactly what their reasoning was behind shutting him down, if he actually had pain with performance, or if he was just exercising extra caution in his case.
We're talking about Josh Makin, of course, from Ivy Rehab Physical Therapy with over 18 locations around South Jersey. They're my go-to for physical therapy. They should be yours. Again, Ivy Rehab injury report today here on Hanging with Hennig on 97.3 ESPN. The other part of the conversation we want to get to today, because with the NCAA tournament going on all weekend long, folks can hear coverage coming up at 6 o'clock today on 97.3 ESPN. The run for Iowa State ended. And part of the reason why it ended this week, Dr. Makin, is because of the fact of the loss of another Joshua Jefferson. One of their best players was unavailable. And what's interesting about it is that his injury, it was purely an accident. He literally just came down from doing a layup, landed wrong, ankle bent. So he was unavailable to play. His team lost, which is obviously very devastating for him. So explain to people, when someone has a lower ankle sprain, why is that an injury that it might take someone longer than expected to return from?
So, I think we've all rolled our ankle before, and 9 times out of 10, you'll catch it. You feel your ankle kind of kick back in and you're stable, but, you slip off the edge of a sidewalk and the ankle rolls over. And when that happens, you're putting a lot of strain and stress through the ligaments that run on the outside of the ankle. And as your foot turns inward, those ligaments and tendons get stretched out. And that can cause, different levels of severity of sprains, right? Same thing we talk about the hamstring strain. There's different grades. Some tearing, no tearing. It all depends on how severe that is. That's all going to be diagnosed usually on an MRI. I didn't see they didn't really get into how severe that ankle sprain was for him. They just kind of said he had it. And so, if it's a grade 1, which, these happen to people all the time, right? A grade 1 is going to be just a little bit of stretching the ligament and some of the tendons that run on the outside of the ankle, maybe some mild swelling and tenderness, and then, usually able to walk without any, significant pain there. Usually about 3 to 4 weeks of recovery, and you're back to normal activity, right? Grade 2 is where it gets a little more hairy, because you can have partial tearing of the ligaments, and depending on the activity that you're trying to get back to, in basketball, it's a lot of dynamic jumping and coming down on your foot. Your foot is in an unstable position anyway, and so if you try to get back to activity like that too quickly, because those ligaments and tendons have been stretched out, the ankle itself lacks the stability. And until those ligaments heal and kind of tighten back up, you're at a really high risk of re-injury. So that's why you'll see, when people get an ankle sprain, the athletic training teams in there taping that ankle up, wearing an ankle brace, anytime they're doing any kind of running and athletic activity, because you're at a really high risk of re-rolling the ankle and re-injuring those ligaments until they're fully healed. So in his case, it must have been significant enough that he couldn't go, because that training staff's going to do everything they can do to get their star player out there with, pain control with ice, electrical stimulation, things we use in the clinic, and any kind of anti-inflammatories, after a few days. Because I know in the past, one of the big things was rice. We want to rest and ice and compress it and elevate it. But now we're kind of moving away from that and getting into an active recovery rather than just letting time do it. We're going to start with some, light, gentle range of motion activities, controlling the pain with ice, and then as people are able to walk and do more weight-bearing activities on that foot, you can get into some static balance activity where it's just standing on an unstable surface, like in the clinic. You may have seen some people there standing on a foam pad. And because that foam pad provides, less feedback, your foot and ankle have to work a little harder to stay stable. And then we would progress from a static balance exercise regimen to more dynamic activity where, all right, you're on that unstable surface, you're playing catch with the therapist, and you're going back and forth, moving right and left. And then you're going to get into sport-specific activity with running and cutting drills and really put that ankle through its paces to make sure that it's stable enough to get back to their sport activity.
And so, for the average person who comes into IV rehab, what is a realistic timetable for someone who has, let's say it's a grade 1 lower ankle sprain, someone who, they're not a professional athlete, right? But they want to play maybe a little recreation basketball, maybe they're someone who plays, a little soccer with like a men's league or something. What is a realistic time frame that they should walk in and say, hey, I want to get back to doing what I like to do? Because, for example, I know for me, my process of going through my recovery from my injury took longer than I wanted to. And I needed to be told a couple times, hey, you got to be patient with this process.
Yeah. So, I mean, that's one of the big things with our patients, just trying to, reiterate to them that, it takes time. Everyone wants to get back to what they want to do yesterday. No one wants to come to, go to their physical therapist 2-3 times a week for a month. But unfortunately, that is what it takes for the general population, because, you think about these athletes, they're getting their training teams and their physical therapists, several hours a day, every day. Like, that's their job. For us, we're going to PT one hour, hour and 15, hour and a half, maybe, 2 to 3 days a week. And, then you got to do your home exercises. So I usually tell my patients, if they come in with a mild ankle sprain, you're looking at a good 3 to 4 weeks of physical therapy to kind of recover from this. With the first week to 2 weeks being managing the pain, inflammation, swelling, getting their range of motion back, identifying, maybe there's some other structures that are tight. If the calf is really tight, it's going to put more strain on the ankle in other ways. So identifying what's tight and what's weak, right? And that ankle is going to be weak after this, the injury they sustained to it. So working on resistance band exercises, which if you were there for an ankle sprain, you're really familiar with these, where you're working on strengthening those muscles that are going to prevent that injury from happening again, and allowing that ankle to roll in. They're going to kick in when that rolling in moment happens and save that ankle from rolling in and straining those ligaments and tendons again. So generally about a month for the general population coming into our clinics to recover from an ankle sprain. More severe ankle sprains are going to take a little bit longer. And that's the hard part with what we do, just trying to reiterate to our patients, like, hey, it's not going to be as fast as you want it to be, but, explaining to them up front that this is what you can expect and this is the progression we're going to take, educating the patients. We can't say that enough about, how important it is to educate our patients, because getting them to understand where we are, how we get to where we want to be, and what the ultimate outcome is going to be is, most of what we do in physical therapy.
He's Dr. Josh Makin. We appreciate him joining us for today's edition of the IV Rehab Injury Report. Of course, don't forget IV Rehab with over 18 locations around South Jersey offering best-in-class outpatient physical therapy. And I know it's great because they are my physical therapists here. Josh Hennig on 97.3 ESPN. Dr. Josh Makin, appreciate you jumping on the show today.
Thanks, Josh. Really happy to be here, and I'm glad you're doing well as well.